Hello everyone, this is Dr. Darshan here, consultant gynecologist and infertility specialist. In this video, I am going to talk about fertility, conceiving a baby and establishing a pregnancy. With the time, I have realized that there is a lot of confusion even in the strata of educated population that how these things works. So without wasting time, I will start straightforward. So let's start a normal process. Let's take a normal process how the system in a female works. Okay, now we'll talk about both of the sides, male and female side, and we'll start with the females. So you must remember that there are 5 organs that deal with menstruation and pregnancy. Though there are a lot of organs that are associated with this process, but to make it easy, I am just going to talk about 5 organs, right? So remember, there are 5 organs that deal with menstruation and pregnancy. The first organ is a pituitary gland. What is pituitary gland? It is a pea-sized small gland in our brain, and the work of this gland is to secrete some hormones that are FSH and LH. I hope you understand. Pituitary gland into brain secretes hormones. That's it. Now, this video is very interesting for the females because you need to understand how your menses works. Okay, once you understand this thing, you will be very happy that you will be no more confused about your delayed periods or early periods or just kind of things, right? Now, women get vaginal bleeding that we call menses. Someone called it period, right? So vaginal bleeding happens for 3 days to 7 days every month. So every female have vaginal bleeding almost every month, and they get period for 3 days or 7 days, 3 days to 7 days. So some women who get periods or bleeding for only 3 days, then also it is normal. It is not abnormal. Or some female who is getting her period for 7 days of time, that is also normal. So within this time limit, within these days, if you are getting your periods, then you are lucky, you are normal. So don't have a confusion regarding this. Now, when you see the first drop of blood on your pad, it will be considered as a first day of menses. Remember, in this further video also, we are going to talk about first day. Okay, if someone is having bleeding for 7 days, then when she first seen her pad with red spot, even that day will be counted as a first day, right? Now, in your cycle, if somebody is getting her cycles every 21 days to 35 days, then it is called normal. So some ladies might get their periods or menses every 21 days, or some ladies may get every 35 days. So it is normal. Sometimes women have such confusion that, my period got late for 2 or 3 days. But again, I am going to tell you this is normal. Okay, so the range is 21 days to 35 days. If you are within this range, then you are lucky, you are normal. So don't worry. Now, for example, it is variable too. For example, in month of January, your period came at 21 days, and in the March, the period came after 30 days. Then it's also normal. It varies month to month. It doesn't stay normal in all females. Although in most of the female, this is regular. For example, some female is getting period on every third of the month, so it is normal. But again, if it is shifts 7 days above and down, that means if you are getting your period alternatively, then it's also normal, so no need to worry about that. If you have got your period at 21 days in this month, and if you are getting your period after 30 days in the next month, then also it is normal. Don't be afraid. Now let's continue our talk on the organs. First organ we have already talked about, that is pituitary gland. Pituitary gland is a hormonal gland into the brain. It secretes hormones such as FSH and LH. Now we are not going to in details how it is secreting or how in what amount it secretes, because this will be the medical talks. Okay, so you don't need to worry about that. You just remember pituitary gland secretes FSH and LH, right? The second organ, remember we are going to discuss 5 organs. The second organ is ovary. Ovaries are what? They are the organs which makes eggs. It is similar to the testis in male, which makes sperms. So your ovary makes the eggs, right? Now let's understand the process of egg making in ovary, right? So into your ovary there are certain amount of eggs. Like in this ovary there are 1 2 3 4 5 6 7 8 eggs, and one of these 8 egg, becomes larger, okay, every month. So if you have, remember in ovary there are millions of eggs, okay. From those millions of eggs, one egg becomes larger every month, okay. So and the time of becoming larger, for example, if your ovary has smaller eggs and one of the egg becomes larger, the time it takes to become larger, it varies from 7 days to even 21 days. For example, if one woman in which the egg is becoming larger in 7 days, in some other woman it may become larger in 21 days, and that is normal, right? Now once the egg reaches to a size of around 2 centimeters, then it ruptures. Then the egg is ruptures and goes outside of the ovary, right? So this is called ovulation. What is called ovulation? Your egg increases in size, it reaches about 20 to 22 millimeter or 2 centimeter. It is going to rupture, and a very small egg inside that big egg will release into your tummy, right? That is called ovulation, right? Now this egg, the released egg, okay, will go inside the tubes and to the uterus, that we will see in this video. But for now you remember that one egg becomes bigger and it ruptures and goes outside of the ovary into your tummy. So your ovaries are into your tummy, and every month one egg releases into your tummy, right? Now how to know your day of ovulation, because many of the women have such kind of knowledge already got from the internet that yes, ovulation should happen, that ovulation happens on the 14th day of my cycle. No, it is not that. If you want to count, or if you want to suppose that day of ovulation, then here is a technique. So if your menses day 1 was on 14th of the January, if your menses starts from the 14th of the January, then your ovulation will be mostly on 1st January. Right? So what I'm trying to say, your egg will rupture 14th day before the menses come. Right? So your egg might have ruptured at around 1st January. Right? So what I'm trying to say, your ovulation happens 14th day before your menses starts. Right? So if you want to expect that, if you want to know your probable ovulation day, then what you will do, if you are expecting your periods, because most of the females know that when their period will come, right? With the learning or with the experience, they have learned that you are already knowing that when your period will come, right? So if you are expecting your period on 14th of the February, let's say, then your egg will rupture around 1st February. Right? So this is just a supposing things. Okay. It might not happen as I told you, but in most of the cases, it happens like that only. So if you are expecting your period on 14th February, then you should know that your ovulation is somewhere around 1st February, a 1 or 2 day before or after. Right? Now there is some interesting thing. Now the egg which is released into your tummy from the ovary goes inside the tubes, and from the tubes it will go inside the uterus. Uterus is the third organ there we are going to discuss, and fallopian tubes are the fourth organ that we are going to discuss. That means your egg need to go into the uterus via tubes. Okay, so this is uterus and these are the tubes of uterus. So the egg released from your ovary into the tummy, then it will find its way into the tubes, right? And it will stay in tube for 5 days at least. Right? Now what happens? Now when your ovulation has happened, right? Let's say your ovulation has happened, and during that time only you have done or you are undergoing an unprotected sex, then at that time the sperms will be released into the vagina. And from the vagina, the sperm will enter into the uterus. They will travel throughout the uterus. They will enter into the fallopian tubes, and they will reach to the egg, which is already there in the tube, right? So remember, your egg which goes inside your tube remains alive for 72 hours. That means for 3 days. So within 3 days, if you have done your unprotected sex, then the sperm will reach throughout the uterus and into the tube to the egg. Now the fertilization happens. Fertilization means the sperm will go inside the egg. The egg is larger in size while the sperm is smaller in size. So this sperm will just enter into the egg, and that is called fertilization. So fertilization happens at tubes, right? Now, once the egg is fertilized, once the sperm and egg are mixed, then it becomes the embryo. Now the embryo is the early stage of your baby. It is very small. You can only see it in the microscope. So it looks like this if you see in the microscope. Now this embryo, which is certainly your baby, right? This embryo will travel into the tube and reach into the uterus within 5 days, right? Once your embryo reaches into the uterus, it will implant into the endometrium. Now, the endometrium is the fifth organ that that I'm going to discuss. What is endometrium? Endometrium is the lining of the uterus. This yellow thing here is the endometrium. And the embryo can only implant into a good endometrium. Right? Because your embryo, the baby will be formed from your embryo. So, your little baby needs nutrition and everything, oxygens and everything from the endometrium only. Right? So, endometrium is a very important organ. Right? Now I am going to tell you one more scientific thing, like that who makes the endometrium? What are the hormones that make endometrium? Because the endometrium is made by hormones. Okay? So from where those hormones will come? So as I said you before, the pituitary gland who secretes FSH and LH in the brain will make your egg in the ovary to increase in size, right? And now your egg which was into the ovary makes hormones, and those hormones are estrogen and progesterone. The hormones are estrogen and progesterone, and this estrogen and progesterone makes your endometrium. Right? So indirectly those FSH and LH, then the ovary, and then comes the estrogen and progesterone who make your endometrium. So you need to have sufficient amount of estrogen and progesterone in your body to make a good endometrium. Right? Now the embryo, that means your baby, will only implant into a good endometrium. This is just like a simpler that we see every day, that a seed will only grow inside a good soil. So a seed needs a good soil for growth, right? So this is simpler in that way. Now, as simple as that. So let's say if there is no unprotected sex on time, because most of couple who suffer from infertility, there is a problem with their timing. If there is no unprotected sex on the time when the egg was there inside the tubes, then pregnancy will not happen. It is as simple as that, right? Now if the pregnancy is not happened, okay, if you people have not undergone the unprotected sex, then what will happen? Then after 14th day of the ovulation, the estrogen and progesterone will go down. So once the estrogen and progesterone will go down, the endometrium will lose its support. So as I have told you, estrogen and progesterone makes the endometrium. If pregnancy does not happen, then the estrogen and progesterone levels will be down, and that's why your endometrium will not get support, and then it will shade. And the shading of endometrium is nothing but your menses. Okay, the shading of the endometrium is your menses. Now let's talk about some facts. If you are getting your menses regularly, then there are higher chances that you are fertile. Right? Now with this lesson, just understand the reasons of not able to conceive a baby by yourself only. If there is no sperms, then or less sperms, then the baby will be not there. You won't able to conceive a baby. If there are no eggs into the female, then also there can be a problem. A sperms in male or eggs in female, if there are not there in sufficient amount, then you might get problem in conceiving. If your fallopian tubes are blocked, sometimes such fallopian tubes, which are very smaller organ or very tiny organ, if they are blocked and not opened, and that time the egg will not able to go inside the tube and will not able to meet the sperms, then also your baby will be not conceived, right? The fourth reason is endometrium. Even everything is going on but your endometrium is not good, then also you will be facing problem of not conceiving the baby. Okay, now let's have some practical aspects. I have seen many patients or many young children or many young teenagers, let's say around 18, 19, 20, 21 year old, who wants to know whether they are fertile or not. Right? So they want to pre-check their fertility. So how to pre-check your fertility? See, you can't just do a confirmation that you are fertile or not fertile. There is nothing such thing that if you do some test, you will know that you are 100% fertile. And if the test comes wrong, then you are 100% infertile. Okay, this is not a case. You can have some idea by doing simple two tests. If you want to test your fertility, for the males, they can go for semen analysis. Semen analysis is a pathological test and you can do it in any pathology lab, right? So if you want to know your fertility, you can directly go and have your semen analysis done, right? For the females, if they want to get an idea whether they are fertile or not, they can simply go a sonography, a pelvic sonography, that is ultrasound and follicular study. So you need to go for a pelvic sonography or a follicular study, in which you can know that you can know that your uterus is okay, your eggs are forming there, your eggs increases in size or not. That all details you can know from your sonography. But for doing sonography, you will need a prescription from a doctor, right? So you just can go to any general doctor and ask him or her that just advise me a sonography. So with this basis of a consultation, right, you will be able to do a sonography. Because without the consultation of doctor or without the consultation advice from a doctor, you can't do a sonography legally, right? So please have this in your mind, right? Now also only a gynecologist can read the sonography properly that you are fertile or not, because the details are given, but to interpret those details you need a gynecologist, right? So again, it is not very tough process, right? You can just walk away or you can take an online consultation directly from a gynecologist and get your ultrasound done. That's it. Now with this basic test, you can check your pre-check your infertility. Now one thing I'm going to tell you, those patient or those person or those couples who are trying for conceiving a baby but they are not able to do it for some reason, when they should consult a doctor. Because I have seen a lot of patients, right, they just come to your clinic and just ask, I am not getting pregnant even after 1 month or of the marriage. That is not a case. There are some guidelines which you should follow, that when you should consult your doctor if you are not getting your pregnancy. The previous thing I told you is it was for your pre-check of infertility or pre-check of fertility. But once you get in that phase that you are not able to conceive a child or baby, then you should do a probable unprotected sex for 6 months, right? For 6 months. And if still you are not getting your pregnancy, then only consult a doctor for infertility, right? So there is a time limit decided already, that if you are not getting your pregnancy even after having 6 months of unprotected sex, then you can consult a gynecologist, right? Number two, if any report, if you have done already, that is within a sperm or semen analysis or ultrasound comes abnormal, then also you can consult the gynecologist. If your periods are irregular, or if you are not getting your periods at all, then also you need to consult your gynecologist as soon as possible, because a gynecologist can really help you that how the things is going on, whether it is normal or not, and what you should do to have your baby as soon as possible. So if you are having irregular periods, if your any report if you have done it is abnormal, then you can consult your gynecologist. Okay, one of the most important finding I want to tell you with my own experience is that 90% of the people, 90% of the population who is trying for baby, the case is resolved with simpler treatment only, right? So I have seen this situation that most of the population, general population, don't know, or they don't have any idea that when they should have try for a baby, right? So just consult a gynecologist, it's not a big deal, right? And get your idea that when you should try or when you should do it. Check your systems and just take simpler advices like 1 or 2 pills, then you will be able to conceive your baby. So don't worry, 90% cases are solved with a simpler treatment, right? Even if you are getting such problems, then you can consult me online. The link I have given in the description. You just can consult me online. If you want to pre-check your fertility, then also you can consult me online. I will advise the tests and you can go ahead with the test at your place only. Then you can send me the reports, then I will interpret the reports and just tell you that everything is okay or not. Now there are some questions. With the rise of internet and YouTube, it is seen that there are various influencers or not registered or not expert people giving advices for pregnancy. This is absolutely ridiculous. There are certain tonics available and they claim that if you take this tonic you will be pregnant in no time. So please stay away from such fraud activities, right? If you have any problem, just consult a registered and expert doctor. That's it. And it is not that tough, right? Get your advice properly. Do not have a fear of going to a doctor. Nowadays, doctors are available online, like me. So this was all about the video. Thank you, friends.